Well, hi everybody, welcome. I think I see a lot of familiar faces in here. If you don't know who I am, I'm Tom Chandler. I'm Dean of the Arnold School of Public Health, and I'm very happy, delighted to see such a strong turnout for our 8th annual James E. Clyburn Lecture Series in Health Disparities. And we're doing it in April, and April is appropriate because this is fittingly National Minority Health Month. This is a month where we focus on raising awareness, particularly about minority health and wellness issues, and especially those health issues that affect minorities in disproportionate and even alarming ways. And many of you know here in South Carolina there are many things to be alarmed about in the realm of health and health disparities. For example, 40% of African Americans have high blood pressure, and 17% have type 2 diabetes. That's 63% higher than white folks like myself. African Americans are more than 38% more likely to die from stroke than white Americans. More than 75% of African Americans are overweight or morbidly obese, and that number is rising. Heart disease is a leading cause of death for African American women in South Carolina. And African American men have the highest incidence of prostate cancer in the United States, and they're twice as likely to die from the disease once they're diagnosed than white people. These are not new statistics. Sadly, they're old, they're tired, and they're a key reason why our keynote speaker today, Congressman Clyburn, worked so hard with Sandra Glover and our current president, Harris Pastides, back in 2003 to secure significant funding to begin our Institute for Partnerships to Eliminate Health Disparities here at USC. It's what we lovingly call the IPED. Professor Glover has served tirelessly as the director for IPED since it was founded, and I'd like to take a moment just to say a few words about Sandra. You didn't know I was going to do that, did you? She's been with the Arnold School for 25 years. First as professor in the Department of Health Services Policy and Management, then as my Associate Dean for Health Disparities and Social Justice, where she served in an excellent capacity. She served as Associate Director for the South Carolina Rural Health Research Center, as the Principal Investigator for important NIH-funded research on minority health issues, point of pride. And she's also functioned and served in a host of other key roles in the Arnold School and throughout the university that have been critical to the state and indeed to our nation in the quest, indeed the battle to improve health and wellness for everyone, everywhere, and not just for minorities. She cares about all people. It's an amazing individual. As long as I've known Sandra, she's always been on the front lines of health disparities, never shying away from injustice, never walking away from the fight, and always able and willing to share her knowledge, her kindness, and indeed her wisdom to rectify health inequities in rural, underserved, and underrepresented communities throughout South Carolina and throughout the Southeast. I'm quite sad that after 25 years of devoted service to the university, she's going to be retiring in September. I'm not sure we have a good plan for replacing Sandra because she really can't be replaced, but we're working on it. And I really just want to take a few moments, Sandra, to thank you for your many contributions in these various roles to the university. But mostly I just wanted to say thank you for your very long friendship to me, because you're one of the best friends I have in the school, and you always have been, and you've always been someone that I could count on for guidance and counsel. Humor, you know, anyway. And I just want to thank you. Now, 8 years ago, the IPED created this lecture series to honor Congressman Clyburn, but to also bring together national and regional experts, many of you in the audience today, that are expert in public health practice and health policy and in community outreach. And we've got a number of posters at the back presented by our students in this area. Congressman Clyburn, I'm very happy to say, has been with us in this effort every step of the way. He comes to this lecture every year. He frequently brings his family with him. He motivates us with his guidance and his examples of dedicated public service. And most especially, he helps us to laugh and sometimes to cry with his entertaining reflections on Washington life. He has a new book out. Hopefully you'll talk a little bit about that. And it's a very interesting read. We're particularly honored this year to welcome Congressman Clyburn as the Clyburn Lecture keynote speaker. It's an appropriate time given the transition of IPET. But more importantly, it's important because he's championed the battle to eliminate health disparities in our state and throughout the country every day of every year, and for as long as he has been in public service. He has a distinguished record of standing up for public health and for eliminating health disparities throughout the country. I'm sure you'll hear more about all of that in a few moments, but at this point I'd like to bring up one of our former postdocs in IPED who's now faculty at the University of North Carolina at Charlotte in their Department of Public Health Sciences. Not a competitor, but a friend, Crystal Piper. So if you'd come up, Crystal, and just share a few comments with the audience. Thank you.
Good morning. It is with great pleasure that I stand before you to introduce South Carolina Congressman James E. Clyburn. I was excited and both honored when I was contacted by Gwen and Andrea and asked to be involved in South Carolina Congressman James E. Clyburn Health Disparities Lecture. Anytime I'm asked to do anything for Dr. Glover, it is without hesitation and indeed a pleasure to help. I first met Dr. Glover in 2004 while her husband, Reverend Glover, was serving as interim pastor at my church. It was a Sunday morning at church, and I was giving a graduation speech to recent graduates. And during my speech, I informed the group that I had planned to attend Virginia Commonwealth University to pursue a PhD in public health. Immediately after church, Dr. Glover approached me, introduced herself, and with a beautiful smile, she said, "Please take a look at the public health program at USC." I remember telling her, okay, and I did. I looked into the program and was absolutely impressed with Dr. Glover's work in the Health Services Policy and Management Department and at the Institute for Partnerships to Eliminate Health Disparities, IPED, so I immediately applied. Once I was accepted into the PhD program at USC, I applied for a fellowship and received a letter from the Institute for Partnerships to Eliminate Health Disparities informing me that I had been selected as a W.K. Kellogg Fellowship recipient and all these wonderful educational benefits and funding I would receive. Wow, I was absolutely amazed. I know it is because of Dr. Glover's support, guidance, and leadership that my PhD experience was the best. While working with Dr. Glover, I quickly realized that I was the first W.K. Kellogg Fellowship recipient, and then that was truly an honor. After completing my PhD in 3 years, I approached Dr. Glover, and we discussed the opportunity for a 2-year postdoctoral fellowship. I could not have asked for a better experience. Working with Dr. Glover meaningfully contributed to my long-term career development and methodological training success by providing me the opportunity to independently conduct health services research, build my research agenda, network with expert mentors, and strengthen my skills in scientific writing, research design, and statistical analysis, and grant writing. I also had the leadership opportunity and led the Health Disparities Research Network that involved doctoral students, faculty researchers, and HBCU faculty, W.K. Kellogg Community Partner Schools. Dr. Glover provided me with opportunities that I know I could not have gotten anywhere else. My experience at the Institute for Partnerships to Eliminate Health Disparities were definitely value added to my overall career. Dr. Glover is more than my mentor. She's like a mother, and I often would tell people I am her second daughter, her second Crystal. She would tell me when I was right, and most importantly, she would tell me when I was wrong. I have grown so much since 2004, and after completing my 2-year postdoctoral fellowship, I was able to secure a tenure-track assistant professor position at the University of North Carolina at Charlotte. I remember when Dr. Glover developed the South Carolina Congressman James E. Clyburn Disparities Lecture, and I often admired her hard work and efforts with the event. So I strive to develop a similar initiative at UNC Charlotte, And last year, I developed a strong relationship with North Carolina State Representative Beverly Earl and told her my overall goal was to develop a community-engaged disparities lecture conference. And February 27, 2015, with a team of other faculty in the College of Health and Human Services at UNC Charlotte, we had the inaugural North Carolina State Representative Beverly Earl Health Disparities Conference that had over 100 participants, an expert panel, 18 posters, and over 10 community sponsors. And each moment I planned that event, I'm trying not to look at Dr. Glover, she'll make me cry. And each moment I planned that event, I constantly thought about the training and leadership Dr. Glover gave me personally and professionally. And for that, Dr. Glover, I say thank you, thank you, thank you. Congressman James E. Clyburn, President Barack Obama has said he is one of a handful of people, when they speak, the entire Congress listens. As Assistant Democratic Leader in the 114th Congress, the number 3 Democrat in the House, James E. Clyburn is the leadership liaison to the Appropriations Committee, one of the Democratic Caucus primary liaisons to the White House and chair of the recently formed House Democrats' Democratic Outreach and Engagement Task Force. His humble beginnings in Sumter, South Carolina, as the eldest son of an activist fundamentalist minister and an independent civic-minded beautician grounded him securely in family, faith, and public service. He was elected president of his NAACP youth chapter when he was 12 years old, helped organize many civil rights marches and demonstrations as a student leader at South Carolina State College, and even met his wife, Emily, in jail during one of his incarcerations. When Clyburn came to Congress in 1993, he was elected co-president of his freshman class and quickly rose through leadership ranks. He was elected chairman of the Congressional Black Caucus in 1999, and his reputation as a leader and consensus builder helped him win a difficult 3-way race for House Democratic Caucus vice chair in 2002. 3 years later, he was unanimously elected chair of the Democratic Caucus. When Democrats regained the House majority in 2006, Congressman Clyburn was elevated by his colleagues to House Majority Whip. As a national leader, he has worked to respond to the needs of America's diverse communities. He championed rural communities supporting the development of regional water projects, community health centers, and broadband connections. He has supported higher education by leading the charge for increased Pell Grants, investing millions in science and math programs, and historic preservation in historically Black colleges and universities. He has encouraged economic development by securing funding for empowerment zones, investing in green technology development such as nuclear, wind, hydrogen, and biofuels, and directing 10% of Recovery Act funds to communities 20% under the poverty level for the past 30 years. Clyburn was instrumental in advancing 2 law measures to resolve historic discrimination issues, significantly reducing the statutory disparity in cocaine sentencing and compensating African and Native American farmers who suffered racial discrimination under the USDA loan program. Jim and Emily Clyburn have 3 daughters, Mignon, Jennifer Reed, and Angela Hannibal, 2 son-in-laws, Walter Reed and Cecil Hannibal, and 3 grandchildren, Walter A. Clyburn Reed, Sydney Alexis Reed, and Layla Joanne Clyburn Hannibal. I present to you Congressman James E. Clyburn. Thank you.
Thank you. Thank you very much. Thank you. Thank you very much. Thank you. Thank you very much. Thank you, Dr. Piper, for being so effusive with your introduction here this morning. And thank you, Sandra Glover, for giving us all an excuse to be here. Thanks to all of you for giving of your time and effort to be here with us today as we celebrate our 8th annual lecture. That means, I suspect, we've been doing this for 9 years. We had an inaugural, and then this is our 8th annual. I'm a little bit emotional about saying goodbye to Sandra, and I know you usually do this at the end of a talk, but I'm going to do this at the beginning, because I need to thank Dr. Piper and Dr. Chandler for taking all I was going to say about Sandra away from me. So I want you to come up just for a moment, and because I want to make a presentation to you before I begin my talk. Now, what I usually do when there is some occasion or someone has done something I think is really monumental, I tend to go to the floor of the House and enter into the House proceedings of that day, what I consider to be important about the person or the incident. So last Wednesday, the 22nd, I had entered into the congressional record my farewell to Dr. Glover, and I want to give her a copy of those proceedings from that day. This is a congressional record for last Wednesday, and in here is my tribute to you. And this is a copy of the tribute, so that you can display it anywhere you want to. I used to put a picture in there so people will know how the person looked who put it in. Now, I figured she knew how I looked, so I didn't need to. And the picture that's in there is basically this picture, which, as you can see, is when I had a little more hair than I currently have. I want to share with you a little bit of what's there. Dr. Martin Luther King Jr. famously said back in 1966, at the National Convention of the Medical Committee for Human Rights, he uttered these words: of all the forms of inequality, injustice in health care is the most shocking and inhumane. Of all the forms you can imagine, for Martin Luther King Jr. in 1966. This is 3 years after he sat in the Birmingham City Jail, 3 years after the March on Washington. He uttered those words: of all the forms of inequality, injustice in health care, the most shocking and the most inhumane. If that doesn't tell us something, then nothing will. Now, what makes it so shocking? Well, let's just take a look at South Carolina. South Carolinians are in worse health than most Americans. The United Health Foundation ranks South Carolina as 42nd in overall health. 42nd. That means there are only 8 states that's ranked below us in health. The average South Carolinian dies nearly 2 years earlier than the average American. Much of my congressional district, and just so you know, you're sitting in the 6th congressional district. A lot of people are a little shocked to find out that the University of South Carolina, every inch of it, the Citadel, Columbia College, and all of the HBCUs, save the two-year institution up at Rock Hill Clinton Junior College. All of those institutions are in the 6th Congressional District, including the Medical University of South Carolina. They have all of this research capacity at the Medical University, at the University of South Carolina. All of these 7 HBCUs, one of, if not the, leading military academies outside of the service institutions, all in not just South Carolina, but in the 6th Congressional District. And in this district, with all of that, life expectancy in counties like Orangeburg, Allendale, Bamberg, and Williamsburg stands at right around 73 years, a full 7 years behind the nation as a whole. In fact, in the 6th Congressional District, the life expectancy is worse than it is in Venezuela, Libya, Iran, and Syria. This is very troubling to me. And it's one of the reasons we gather here today, and that we have been gathering here now, addressing this subject for now 9 years. In 2011, 19.4% of the non-elderly South Carolinians were uninsured. This comes out to 700,000 people. 700,000 people in South Carolina without health insurance. Even for people with coverage, access to health care has been scarce. Now, what does that lead to? That leads to things like the visit I got from the leaders of Dillon County several years ago. In fact, this visit took place on the day that we were discussing the Affordable Care Act. Many of you may recall the one session that we had on the Affordable Care Act that was televised live by C-SPAN took place at the Blair House. This is the house directly across the street from the White House. And on that day that we were holding that session, I had just left a meeting with leaders from Dillon County, and they were asking my help on significantly increasing the size of their emergency room. I'm sitting there thinking as they made their request. Finally, when they were finished, I asked, I said, now you're asking me to help you increase the size of your emergency room. I said, I come home every weekend. And when I get home, I read all the newspapers that have been gathered for the week. And I don't recall seeing any big increase in accidents along I-95. I don't recall seeing any significant outbreak that would call for us increasing the size of your emergency room. They said, well, it's not about accidents. It's our emergency room is the primary care room for the citizens of our county. They come to us for primary care. Many of them don't have health insurance, but many of them do have, but cannot afford the co-payment. And so they come to us. and we need more room to serve them. Now, this was the day that I was getting ready to go over to the Blair House. And so when it came time for me to speak, you know, those of you who watch these things, we usually do something we call a round robin. That means when the president is presiding, it is bipartisan, and we sit and speak by rank. The president opens, he goes to the Speaker of the House, over to the leader of the Senate, back over to the leader of the House, back over to the assistant leader in the Senate, and then it comes to the whip. And I was majority whip at the time. I didn't talk about all of this stuff about the cost curve and that stuff that I don't really understand. I talked about what I had just heard from the people of Dillon County, and I said to them on that day, this ain't about all of this highfalutin discussions that we have. This is about basic health care delivery, basic access to health care, basic access to affordable, quality health care. And that's why I fought so hard for community health centers. Because to me, that was the quickest way to get people out of emergency rooms. If we had a community health center network throughout this country, and when the Affordable Care Act left the House, I just want y'all to know I did my job. And there are people here who will tell you, when that bill left the House, we had 100% coverage in community health centers. Well, you know, we got a bicameral legislature. And the senators, when they finished their work, it wasn't quite 100%. In fact, it wasn't quite 75%. But we got a significant increase, and I'm pleased to say that even what we did a month ago, I received a visit in my office. I'm not going to out y'all in here who were beating up on me. We got this cliff that we were about to go over. And it meant that healthcare centers in this state and others were about to go out of business. But I'm pleased to say today that this time I did my job and it held. And the $9 billion needed to avoid going over that cliff, we got funded, and it's now law. Now, disparities in healthcare leads to significant increases in costs. The most expensive care, healthcare that you can get is in the emergency rooms. Now, emergency rooms have their place, emergencies, but they should not be there for primary care. It seems to me that community health centers, just a no-brainer, an absolutely no-brainer. Even if you didn't have anything with health care, let's just take a look at Charleston. If you're living in McClellanville or Wapmalo Island, your kid slams his hands in the automobile door. You know how long you got to go to get down to an emergency room? It's a no-brainer to me. And I don't understand, quite frankly, how we can consider to tolerate such. Now, this theme today is about passing the torch, reignite the flame. Let me tell you why I like this thing. They didn't ask me. I don't know whose idea it was. I kind of thought since my name was on the thing, they would at least ask me. I don't care what you say, Dr. Piper. Sandra doesn't ask anything. She just does it and tell you. Sam, I don't know how you've done it all these years, but hope she doesn't treat you like she treats me. I'll tell you what I'm interested about. You know, this is, many of you have seen the movie Selma. And you tend to equate Selma, March 7th, 1965, Bloody Sunday. Everybody see that as a direct line to August 6, 1965, which was the day that the Voting Rights Act was signed into law. So anytime we talk about Selma, anytime we talk about Bloody Sunday, we always talk about that as leading to the Voting Rights Act. Well, here's why I like this theme, reigniting the flame. A lot of other things happen as a result of Bloody Sunday. It wasn't just the Voting Rights Act. And come August 6th, I plan to be down in Memphis at the Lorraine Motel that's been turned into a museum, the place where King was shot. I plan to be there to celebrate the 50th anniversary. But 2 weeks ago, I celebrated another 50th anniversary. 5 weeks after Bloody Sunday, this country made its first national commitment to educating children. Think about that. Made its first national commitment 50 years ago. Now that may sound strange to you, but just 50 years before that, Robert Smalls died. Robert Smalls died in 1915. But Robert Smalls, at the first Constitutional Convention after the ending of slavery, 1868, State Constitutional Convention, Robert Smalls introduced a resolution calling for the education, free public education for all. Before that time, education was reserved for the elite. I always say, and I wrote an op-ed piece for the Island Packet a few weeks ago, I said that, to me, and I know some of my friends might get a little upset about that, but there's a value in living to get north of 70. And I'm north of 70. So if they don't mind, they got a problem. I don't mind. I think he's the most consequential South Carolinian to ever live. If you study his history from birth to death and are honest with our history, I believe you would agree with me. Because that resolution made South Carolina the first state in the United States of America to offer free public education for all. There may be a lot of areas where we trailed in healthcare, but we started the country on the movement to free public education. And it took 50 years for the country to catch up with us. Because it was in 1965, April 11th, when Congress passed the Elementary and Secondary Education Act, 5 weeks after Bloody Sunday. The next month, May 18th, President Johnson launched Head Start. On May 18th, we will be celebrating the 50th anniversary of Head Start. Come July 30th, Congress passed Medicare and Medicaid. They were signed into law in July, and we saw people, seniors, saw their what we call poverty indexed drop from 20% down to 13% because of Medicare. And if anybody tells you Medicare is not worth it, you get away from them. And just a few weeks after we passed the Voting Rights Act in August 6th, a lot of people don't realize this. But HUD, the Department of Housing and Urban Development, was created in September 1965. It was in 1965, in October, that Congress passed a law that outlawed for the first time immigration quotas. And looking around this room, outlawing immigration quotas, it happened in 1965, a direct result of Bloody Sunday. Congress made its first national commitment to higher education on November the 8th, 1965. You go back and check, you will see that fully 30 progressive laws were passed in 1965, and they're all still on the books today. And when people tell you that the Great Society programs fail, tell them they must not be able to read. Reignite the flame. The flame is burning low. The heat is fading. It is up to us to reignite that flame. We can get rid of health disparities. I remember Janice Marshall, who is here, who is the director of my little foundation, came to me with an idea. She said, you know, there's a way that we can form a partnership between the University of South Carolina School of Public Health and Claflin University. Now, I just told you there are 7 HBCUs in my district. I don't know why she came up with Claflin. Maybe it's because that's where she graduated from. But she convinced me, and our little foundation set up this little partnership where a student could go to Claflin for 4 years and come to the university for a year in public health and come out with a bachelor's and a master's in public health. And I was very pleased. Was it last year or year before? Year before last. We gave out the first scholarship to that person. That made me feel as if all of this is worthwhile. And I was pleased to get the report a couple of days ago. There's some people doing some good investments. That little endowment is now up to $170,000. Y'all ought to be proud. Janice, you ought to be proud. And I thank you so much for that. What we want to do is eliminate health disparities. Any country that can put a person on the moon and return that person safely to Earth, any country that can do that can get rid of health disparities. My father the fundamentalist minister, used to tell me all the time, son, where there is a will, there's a way. And the only reason that we have not gotten rid of health disparities in this great country is because we have yet to develop the will to do so. I've never seen throughout my studies of history, and as I live it, anytime we decide to do something in Washington, it gets done. It's not drug out. It's done. What we've got to do is create conditions within which our legislators will develop the will to get it done. Now, what does it take? Well, one of the main reasons we have all of these bad statistics in health is because of economic conditions. I mean, the reason people, anybody who can afford it, they would get health insurance. They don't get it because they can't afford it. And we got to make it affordable. And that's what the Affordable Care Act was all about, making it affordable. I will always remember, some of you recall, we passed that bill late one Sunday evening. And the next morning, I had no idea we were going to be in session all weekend, late into the night. And I had agreed to speak for an energy conference in Amelia Island the next morning. So when I left the floor somewhere around 1:30 or 2 o'clock in the morning, boarded a plane to get down to Savannah, Georgia, so I could get over, or get to Jacksonville, Florida, so I could get over to Amelia Island. My eyes felt like pins were in them. And I got an email. And one eye at a time, I read that email. It was from a lady from Florence. And she said this to me. She said, I stayed up last night waiting for this vote. She said, the reason I stayed up to wait is because 2 weeks ago, I got a letter from my insurance company telling me that because of my 8-year-old daughter's cancer treatment, we had used up for a lifetime all of our health care. And I've been staying up every night wondering what's going to happen if my daughter's cancer were to come back. What would happen if my husband or I were to get sick? What would happen to one of the other children? We've got no more health care. It reached the limit. He said, and when you all passed the bill, I cried. That's what the Affordable Care Act is all about. All of this foolishness about not wanting to expand Medicaid. I don't care who it is. I just told y'all, I'm north of 70 now. I don't give a hoot. Who says to the contrary? It is absolutely incredulous. It's crazy for us not to expand Medicaid in this state. This is about making health care affordable. We didn't say make it free. Make it affordable. That little 8-year-old child, I have no idea what has happened to that family. I have not heard from her since. But I hope the cancer did not come back. But I feel good about the fact that if it does come back, I've done my part to make sure that child can get the health care. I did a radio program one day, about 2 weeks before. And it was a call-in show. Some of you, that's a noon show here in Columbia. Don Frison does the show. And Don was asking me about the vote coming up. When we started to call in, a gentleman called in and he said, I want you and Obama to keep your hands off of my insurance. He said, I like what I have, and I don't want y'all messing with it. I'm against this health care law, and I don't want y'all fooling around with my health insurance. Well, one of the other things my dad used to teach me, that when you can't say anything good, don't say anything. So I didn't say anything. But about 4 or 5 minutes later, another call came in. And this time it was a lady. She says, I don't have a question, Congressman. I just got a statement I want to make. I want to say something to that gentleman who called in a few minutes ago who says he likes his health insurance. She says, I am 48 years old. I started working at 22. So I worked on the same job. I paid my premiums every month on time. But I found out a year ago that I had breast cancer. And she says, after I went for my second treatment, I got a letter from my insurance company telling me I had no more coverage. She says, I want to say to that gentleman, maybe he likes what he has because he's never tried to use it. She said, I like what I had. So I like what I had until I tried to use it. That's what this is all about. I want to say one last thing about the Affordable Care Act, because this one gets me. Every now and then, I go to groups like this, and I just kind of ask them, how many of you recently got a little rebate check from your health insurance company? And invariably, see it? Invariably, hands go up. And then when you ask them, why did you get that check? They all think it's because the insurance company felt good about them. Nothing could be further from the truth. When we passed the Affordable Care Act, we decided that there was something wrong with insurance executives denying payments to children born with diabetes, denying payments to people once they reach a certain cap, kicking people off the insurance policies once they got sick. And we said that in this law, every insurance company must return 80% of the premiums you pay, you must use. No more than 20% for your executives. 80% must go back to your premium holders in the form of benefits. And if at the end of the year, when your audit is done, if you have not returned 80% of those premiums back to your policyholders in the form of benefits, you must write them a rebate check. That's why y'all got them checks. Because of Obamacare. Now, I don't know that we can see great fault with that. I'll tell you, and any fair-minded insurance company will tell you, 20% is a great return for them. They can get bonuses. They just can't pay themselves $30 million while everybody else is sick, which is what one governor, who was a former health insurance executive, that was his bonus the year before he left to run for governor. $30 million 1 year. Bonus. So what we would like to do is reignite the flame. We got to look around at all of this, and we got to say, we can do better. We got to look at all of this, and we've got to say, as we celebrate the 50th anniversary of some great efforts, this is the year to reignite the flame. And I just want Sandra Glover to know that if she thinks for one moment that she is marching into the sunset, that she is going to be sitting around her house, smiling at her husband, she got another think coming. We're going to reignite the flame, and we hope that you keep it burning. Thank you, and Godspeed.